Hi, I'm Nick Reese. I'm a clinician here at Complete Physical Therapy, and today I want to show you how you can use flossing band to loosen the knee up. If you have a sore spot in your knee, the outside, the inside, underneath the kneecap, over the top, it's a quick and easy way to try to promote mobility in this joint. So first thing I'm going to do is going to show you how to wrap this. Depending if I have pain on the outside or the inside is where I'm going to put more pressure. I normally would not be wearing pants, but I really don't feel like taking my pants off, so we're going to do it over the top of my pants. I'm going to get my set point here. I typically need more pressure on the outside, so I'm going to pull a little harder when I go around the outside. I also want to overlap it about 50%. We talk about the amount of stretch we can put there. That's another cue, maybe about 50%. However, if I've done it a few times, I'm comfortable, I tend to pull a little bit harder. I'm going to stop right underneath the bony part of my kneecap right here. The next time I want to go over the top, I'm going to make a little smiley face here. I stop right over that kneecap again. I'm going to pull down so I gather tissue on this side and this side. Then I'm going to start to work my way up my thigh. Obviously, the size of your thigh is going to depend on how much band you can get. I always think the trickiest part here is the very end where I try to get that to slide underneath there. First thing you can do, you can use your hands and just twist and turn. You find a sore spot, work that tissue, try to free that tissue up. So twisting and turning doesn't have to be any specific direction, just move that tissue. We want it to slide and glide. From there, go into a motion that typically gives you a hard time. Say we're going down the stairs and that gives us a hard time. I'm going to pull out a box here. I can stand on the edge of that and I can work on stepping down. I'm going to typically move 15 to 20 repetitions till I feel like that's starting to loosen up. Another motion that may bother you is squatting down. I'll squat down deep and try to loosen that up, moving into that end range. The other thing, once I really starting to loosen up, depending on what your goal is, I'll even get down on my hands and knees and I'll start to sit back, trying to get that very end range. As that starts to loosen up, I'll even reach back behind me and then I'll press my hips forward. I'll get a big stretch across my quad when I do that. The directions, the motions, doesn't matter. You think about what's restricted and you're going to use this to try to improve that motion. And